Thank you, Lauren. This news is alarming for people who received the Johnson & Johnson vaccine in the past couple of weeks. Federal health agencies recommend an immediate pause to use the single-dose coronavirus vaccine. 6 women between 18 and 48 developed a rare disorder involving blood clots within 2 weeks of their vaccination. 1 woman died. Another woman in Nebraska is in critical condition. Tomorrow, the CDC's independent review panel will meet to discuss all of this. The pause allows for a full investigation.
You want to make sure that safety is the important issue here. We are totally aware that this is a very rare event. We want to get this worked out as quickly as we possibly can. And that's why you see the word pause. In other words, you want to hold off for a bit and very well may go back to that, maybe with some conditions or maybe not. But we want to leave that up to the FDA and the CDC to investigate this carefully.
This evening, we do have Team 12 coverage. Sean McCabe is talking to medical experts. First, to News 12 Connecticut's John Craven. He is at a mass vaccination site in Stamford. John, what's the effect there?
Well, Della, to be honest, very little effect at all here. In fact, this vaccination site at the old Lord & Taylor store was barely even using J&J. And other sites that were are pivoting to other brands. News that the Johnson & Johnson vaccine is on hold sent shockwaves around the world. But Governor Lamont says the impact in Connecticut should be minimal.
This pause in J&J is going to be probably measured in days, not weeks. So, sit tight with your J&J vaccine.
The state had already cut back on J&J because of supply shortages. Last week's shipment was 40% Johnson & Johnson. This week, it's only 8%. And next week, Connecticut will get even more Pfizer and Moderna doses to fill the shortfall.
All of our vaccine sites will still be open.
Hartford HealthCare's clinical director says the pause barely affects them because they were only using J&J in limited circumstances. But if there's a run on other brands, they may have to cut back appointment slots.
The amount of people we can vaccinate in any given week will be affected depending on the total of the vaccine that we're administering.
FEMA's mobile vaccination van is still taking walk-ins, but now with the Pfizer shot. Norwalk's Bowtie Cinema site switched to Moderna. But remember, if you have a Johnson & Johnson appointment, you'll now have to schedule a second dose, which may take a few days to book.
Today, we may not be able to schedule that second appointment every time. The goal will be to get the second appointment scheduled at the time of the first. But today and possibly tomorrow, we're going to have to work through some of those glitches.
Well, the good news here is that you should be able to get your second dose at the same place that you got your first dose. In Stamford, John Craven, News 12, Connecticut.
Now let's go to Sean McCabe. He's been talking with doctors about what J&J recipients should look out for and just how concerned they should be.
The shot felt like any normal shot. It hurt a little, I think because it was cold.
Nicole Betts of Stamford got her Johnson & Johnson shot last Wednesday.
I'm worried, of course. I have a daughter and everything, but I feel fine. So I'm going to trust the science behind it.
We're talking about right now 6 cases out of more than 7 million people getting the vaccination.
Dr. George Goshua is a hematology fellow at Yale Medicine. He says patients hospitalized with COVID-19 infection are at much higher risk of clotting than those vaccinated.
We know that the risk in the ICU patient population is 20% for developing blood clots.
Researchers say the risk may not have been caught in vaccine clinical trials because trials involve thousands of people rather than millions.
Even if a signal didn't come out in the setting of a clinical trial, I think it's possible that there may be a signal when you start vaccinating such a large number of people.
Dr. Young Chun says some of the clots could be due to other risk factors, like medication.
One medication that people are on that does increase risk of blood clot is birth control.
Doctors say if you got the J&J shot, there's no reason to panic, but there are symptoms you can watch for.
Watch for symptoms of headache that are getting progressively worse over the course of days. Watch for abdominal pain that's not resolving. Watch for bloody diarrhea.
Even given the evidence and what's going on, I'd still get a vaccine.
Beth says panic isn't going to keep her from getting back to her life again.
I think we're still learning about them, but I think we're better off getting them and trying to get back to somewhat of a normal life again.
Sean McCabe, News 12, Connecticut.
The CDC has a website where you can check in and track any post-vaccination issues. It's called vSafe. All you need is your phone and information about the vaccine you received. You can see the instructions right there on your screen. We're also linking it on our website, news12.com.